Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It is our COVID-19 briefing today, which is April the 29th. Over the next number of days, there'll be a briefing tomorrow at 3 o'clock here in the Press Theatre. Dr. Henry, on Friday, we will be doing a statement with an update on important events on Friday at 3 o'clock with an update on cases. Dr. Henry will be giving a briefing here Saturday at noon. And then on Monday, we'll be giving a briefing that will include some updating of modeling at 1:30 on Monday afternoon. And so with that, and acknowledging that we're on the traditional territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations, I'd like to have the honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For our update today, we have 34 new test positive cases here in British Columbia, bringing our total number of people who have tested positive to 2,087 in British Columbia. That includes 811 people in the Vancouver Coastal Health Region, 941 in the Fraser Health Region, 120 people in the Vancouver Island Health Authority region, 169 in Interior Health Region, and 46 people up in the north. We have 24 active long-term care or acute care or assisted living facility outbreaks right now. So that's two additional ones where we have a single person who has been who has tested positive, and an outbreak response is ongoing. One of those is in Clayton Heights, and the other is Langley Lodge in Fraser Health. Langley Lodge did have an outbreak earlier on a few weeks ago that was declared over, but a new case has been identified, so they are back into ensuring that they have all of the outbreak precautions in place. Overall, in long-term care assisted living or in the acute care, the 3 acute care units, we have 252 residents who are affected and 152 staff. There are 13 outbreaks that are now declared over, including one of the outbreaks in Interior Health, the Kootenay Street Village, which has had no cases for the last 2 incubation periods. We continue to have ongoing testing and investigations at our community outbreaks, and we are now up to 50 people who have tested positive at Superior Poultry and 42 people at the United Poultry work site. And we know that, again, the investigations are ongoing, both in those 2 areas and also in a number of other workplaces where there is potential for transmission and cases have been identified, and we know that those investigations are ongoing as well. There's no change in the number of people who have tested positive at the Federal Correctional Facility in Mission, the Mission Medium Correctional Facility. We remain at 120, including 108 inmates and 12 staff. We also, at this point, have 89 people who are hospitalized, and of those, 35 are in critical care or ICU. Unfortunately, we have an additional 4 deaths to report today, bringing the total number of people who've died from COVID-19 to 109 in British Columbia. And all 4 of the people who passed away in the last day were seniors and elders from long-term care homes in our outbreaks. And again, you know, every time we think of the people who have been affected by this, and our heart goes out to their families, to their caregivers in their communities who will miss them. Yesterday I reported on a death in Interior Health, and just a little bit more detail, and that person was a man in his 70s who had been in hospital for some time and had acquired his COVID-19 whilst traveling outside of Canada a number of weeks ago. We now have 1,305 people, and I've checked those numbers today, who have fully recovered from COVID-19 in British Columbia. We've spoken extensively over the last many days and weeks about our testing strategy, and I just wanted to reiterate that we are changing and modifying as we do based on the circumstances that we have here in British Columbia, and our testing strategy will continue to evolve. Right now, as we've talked about, testing is available to anybody in our community who has symptoms of COVID-19, including even very mild symptoms, and is also being used quite extensively, as we've talked about, for identification and investigation of clusters, because we recognize that sometimes, particularly in some of the workplace clusters that we've been looking at and at the federal prison and our long-term care outbreaks, that people can have very mild illness or may have unrecognized illness or may have reasons why they are reluctant to reveal that they're feeling unwell or they have some mild illness, and it could be related to concerns about employment and concerns about passing it on to others. So we have taken an approach of having very broad testing in those types of environments to make sure that we catch everybody, even people who might have very mild or no symptoms at all. It's very important for us to understand, however, that random testing in the community of anybody with no symptoms is of very little value to us with the current tests that we have. In fact, that type of testing leads to both false positives and false negatives. And for a variety of reasons, it's not a reliable mechanism to understand what's happening in our communities when it's used that way. The best things and the most important things we need to continue to do in our communities, all of us now, is to continue to clean our hands regularly, to not touch our face, to cover our cough and sneezes, to ensure we're keeping our safe physical distance, and to have a very, very sensitive threshold for staying home and staying away from others if we're not feeling well. It's important for us to understand as well where testing can help us, and I've talked about some of the outbreaks, and just to talk about some of the outbreaks that we've had in the past where this has been really important. You will recall early on in our pandemic here in British Columbia, we had a number of cases who were related to a dental conference that was being held in Vancouver, and just to give people an update, we now have a total of 87 people who were associated with that conference here in British Columbia, and I know there are additional people in other provinces and around the world who had attended that event, and we know that there was at least one, but probably several people who had COVID-19, most of them probably not recognizing it during the time they were at that event, and it was spread. And as of course we're all aware, here in British Columbia we had one death in a dentist associated with that conference. The other thing that we are doing that is really important for our next strategy, our next phase, is making sure that we're monitoring everybody that's coming into British Columbia from outside the country. And that includes the measures that we put in place to enhance the federal measures at our borders for people who are returning to British Columbia. And we've assessed over 15,000 people who have returned to British Columbia. These are Canadians who have returned home. Often they had been away for often many years. And over 15,000 since we started this on April 10th. We reviewed and helped people detail over 4,000 self-isolation plans. Most people's were fine of those 15,000, but some of them needed assistance, and over 350 people needed additional support to be able to implement their isolation plans. In addition, we've had almost 100 people who we have provided accommodation to and supported to be able to enact their self-isolation plans to protect both themselves and their families and our communities here in BC. And I really want to tip my hat and thank all of the public servants and our public health professionals who supported people in being able to do that, and the measures at the border. In addition, we have put in additional supports for our temporary foreign workers who've come into British Columbia to support our essential work on farms and across the province. And of the over 900 temporary foreign workers who've come in over the last few weeks, We've provided them with both medical support, social supports, and accommodation to be able to effectively quarantine. Some of those people have finished their quarantine and are now going to our farms across the province to support the agriculture, the necessary support that we need. I will note that out of the 900 and some people who we have monitored in this way, we have had 4 people from 4 different flights of temporary foreign workers who've come into the province who've tested positive for COVID-19. So it just speaks to us of how important it is to keep up these measures, to support people, to make sure that they can do what we need them to do, and to be able to identify people who have symptoms, get them tested, and be able to support them medically as well through getting over their COVID-19 if that arises. So today the Premier shared that the framework for our BC New Normal approach will be provided to you next week. We've highlighted that we are being thoughtful and careful and purposeful in our planning. And on Monday, we'll be providing our latest modeling and some more details, plus some more details around the epidemiology about who has been affected and where and how here in British Columbia. This is our path forward, and we are looking forward to being able to share that information with you. As we're all well aware, this virus is challenging us every day. The public health measures that we have in place, the illness the virus causes, and the loss of life are hard on all of us. The orders and the restrictions that we have in place now have worked, and they've worked because we have followed them collectively, and we have done our bit to protect our families and our communities. And I need and will continue to thank you all for doing the right thing. You have demonstrated the creativity, the compassion, and the care that we needed to get us through that part of our pandemic. And we need to continue this. We need to continue to work together, to continue to make a difference, and to continue to support each other through this next phase. We are not alone in this, either in BC, in Canada, or around the world. All of us globally have been affected by this pandemic, and we in BC have been shaken by this storm. But we have shown that we can work together and that our foundation remains strong. And we need to continue this with our mantra of being kind and being calm and staying safe.
Thank you very much, Dr. Henry, and I just wanted to join Dr. Henry and on behalf of the Premier and the government, I think the people of BC, to send our condolences to the 4 families of the 4 people who've passed away in the last 24 hours from COVID-19. They and 105 other cases of people who've passed away have suffered a terrible loss in the midst of this difficult pandemic, and we think of them in all 4 cases, 3 of them in Vancouver Coastal Health, 1 in Fraser Health. They were elders and they were in care, but they also in every way represent a huge loss for their community, for their family, and a huge loss to those who were taking care of them. So we're thinking of them today with all our hearts and wishing all our best to their families in what is a difficult time to grieve, but one where we grieve, hopefully, together. As Dr. Henry has said, we have 34 additional cases today. We have 89 people who are in hospital in British Columbia as a result of COVID-19. And well, that number is down. It's 46 in Fraser Health, 6 in Interior Health, 5 on Vancouver Island, 3 in Northern Health, and 29 in Vancouver Coastal Health. 89 is, of course, down from where it was on April 6th, which was 149 cases. There are also fewer people. I think we're down to 35 people in critical care, and we wanted to acknowledge again the extraordinary work by the teams in critical care, from healthcare workers, nurses to doctors, who are working together to provide supports for people with outcomes that have been given the very serious circumstances when people enter critical care, have been very good, and we acknowledge their work and celebrate and recognize their work. There are 4,117 beds that are empty in BC. That means we're operating today at about 63.1% capacity, or 63% capacity, 45.7% capacity in critical care. So in other words, we have and we continue to withstand the cases that have come to us with respect to COVID-19. I also note that we had approximately 4,300 emergency room visits yesterday, and that, while down from the totals, is consistent with what we had with the last number of days, where people are using emergency room services over the last number of days, much more than they had in the early part of April. I wanted to report out on surgical cases and those that have been completed in the period. First of all, from March 16th to April 26th, we've completed 14,597 cases across the 5 regional health authorities and the Provincial Health Services Authority. 8,767 of those were urgent scheduled surgeries, which have continued. 5,830 were unscheduled or emergent or emergency surgeries that were required within a 24 to 48 hour period, just to give you a sense of the work that continues to be done in healthcare. We also have a breakdown of postponed cases. That's 16,101. Should be recognized that this somewhat understates the number of cases that would have taken place otherwise, since cases tend to be scheduled 3 weeks in advance. And so now we understand that there obviously would have been cases, for example, scheduled this week that had not been postponed but would have happened. We would expect by the 3rd week in May that it will be between 28,000 and 30,000 surgeries that would have occurred and that did not occur because of the cancellation of elective surgeries. And so I just wanted to say a couple of other things. Obviously, the Premier spoke today about his plans and our plans as a government in the coming weeks. He addressed BC's renewal and said that in order to open up the economy more than we are now, we need to have a plan, and we need full buy-in from British Columbians. He acknowledged the relative success we've had in flattening the curve, acknowledging also the profound impact COVID-19 has had on all British Columbians. In the days and weeks ahead, as the Premier announces the plan for renewal, and as we all work to implement it, our success will rest on what has got us to that point, and it is what will carry us forward. And that's holding to our 100% commitment to follow the rules and the guidelines Dr. Henry sets out, even as they change somewhat, and adapt to allow us to open up society and the economy to renew BC. Staying 100% all in the weeks and months ahead will build on the success we've achieved and will continue to show what we can accomplish safely and confidently when we're in this all together. All together for the ones we love, all together for the ones we don't know, all together for the ones that we will meet in the future. Aujourd'hui, nous annonçons 34 nouveaux cas pour un total de 2087 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19, 3 à Vancouver Coastal et 1 à Fraser, pour un total de 109 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de centre de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 811 se trouvent à Vancouver Coastal, 941 à Fraser, 120 sur l'île de Vancouver, 169 dans l'intérieur et 46 au nord. Parmi l'ensemble de cas confirmés de COVID-19, 89 personnes sont actuellement hospitalisées, dont 35 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup, and we're happy to take your questions.
Thank you. As to everybody on the phone, please press *1 to enter the queue. You are limited to one question. I'd also ask that you please unmute your phones. You will not be audible until I call your name. First question today is from Jennifer Saltman, Vancouver Sun. Go ahead.
Hi there. I'm wondering if you can tell us a bit more about the 2 new test positive cases for COVID-19 at 2 poultry processing facilities in the Lower Mainland, and what's being done to keep the spread from happening between other facilities.
Yeah, so my understanding is that these have recently come to light. One is a person who is a household member of somebody who is identified in another poultry plant. So that person is not at work, and I know the investigation is ongoing. And in the other instance, it just recently came to light that there was concerns about illness, and I think this is a reflection of the discussions that we've had with the leaders in the meat and poultry industry to make sure that they are monitoring their workers, and that we all are working together to ensure that we are identifying people early. So I know the investigation is ongoing, and that Fraser Health is leading that, and will be doing additional testing at that plant.
Next question is from Shannon Patterson, CTV.
Hi, Dr. Henry. On the reopening plans, hair salons are one of the few businesses that need your permission to reopen. We've been told the industry is submitting its recommendations to you this week. Can you talk about when and how that decision will be made, considering they likely need some time to buy PPE before reopening? And also, clothing stores were not ordered to close, but most of them actually have. Should they go ahead and reopen or wait for instructions from you? So looking for your comments on hair salons and clothing stores too.
So as we know, there are only a small number of industries that we actually put a PHO order on, and places like hair salons, personal service settings, establishments, those were, as well as restaurants, bars, pubs, nightclubs, those types of facilities, as well as gambling facilities. So yes, what we are putting in place and what we will have more details about next week is how the process for providing the information to every sector about what are the parameters that you need to have in place to be able to safely open. And this is not just me, so I'm not the one who can tell what makes things safe for everybody. We have public health inspectors, our environmental health officers who do this as well in the public health side, and we have you in the industry side who know their industry best and are able to say within the parameters, here's a plan that we can come out with. So yes, that was what we have been working on, is where people can go, what are their connections, and how can we make sure that they get the guidance that they need. They can submit, this is how we'll do it, and we'll come up with a provincial recommendations spreadsheet, best practice for everybody to use in that sector. And so that is the work that we're starting and that we'll be doing over the coming weeks, and you'll hear more about the details of that next week. Those businesses that have closed during the last couple of weeks, even though they were not ordered to. Part of that is a reflection of all of us doing our part and trying to make sure that we're reducing as much as possible the connections that we have in the community. And there are many examples of how those, I'm thinking of retail in particular, bookstores and clothing stores and others who've gone to a mixture of online and in person, and how that can be done safely. And those are things as well that we need to have a provincial approach to, so that it's a level playing field for everybody, and also so that we can build confidence, because we as the consumers, there's a lot of concern still and fear about how this is going to work, and none of us want to see us sliding back to having outbreaks in our community. So it is part of my job and part of our job in public health and with the ministries, the government, to work with each sector to say this is the guidance, and once you've met these conditions, you can open safely. And then I can say to all of us, yes, this is how we're going to do it safely over the coming months. So that is all in process. I can't tell you exactly the details right now. And I mentioned this a bit yesterday. Please don't send it all to me right now, because I can't open all of these and I don't have the expertise. We have a process that is being formalized, and we'll be giving more information in the coming days about that.
Next question is from Richard Zisman, Global News.
Dr. Henry, one of the challenges we're hearing a lot about are people with prescriptions, and because of the short window of refills, people are getting hit with fees when they have to refill those prescriptions. Is there any thought of easing those timelines, and what do you say to those people who have to rack up these bills when, especially when times are financially tough.
Yeah, so I know that has been a challenge, and we've talked about this before. The rationale for it early on was because globally there was challenges with access to certain precursor medications and also certain medications, and it was a way of preserving that because we know that there was, a lot of the precursors of our medications we have here are produced in China or India, both of whom had trade restrictions. So there is a federal process that has been monitoring that. That has been, we're now seeing that the supply chains are coming back online, so I do expect there'll be some movement on that in the near future, but it was a prudent measure that we needed to take across the country to ensure that we had appropriate supply for everybody. In terms of the BC part of it, I know Minister Dix has been working on that.
Sure. So, Richard, it's, as you know, early on, especially in March, we saw a little bit with prescriptions, what we saw with groceries, which was there was advice from Health Canada, I think, for people to go and fill prescriptions at the time, and then there was some consumer demand that put some pressure on pharmacies, and so many pharmacies went to a 30-day model. Even though our overall policy in BC didn't change, we didn't change our 100-day maximum supply policy. This week, the BC Pharmacy Association has stated that some of their concerns over pressures have gone away, and they've provided some additional guidance, I think, to their members as well. Remember, on costs, we have a system, a pharmacare system, a fair pharmacare system in British Columbia that reimburses once one reaches a deductible, and obviously when there's more payments that you get to your deductible more quickly and then get to reimbursement quickly. So the net impact is something that we're taking a look at, and people in the pharmacy industry and a lot of seniors have expressed concerns because they have to renew a lot of prescriptions. But we think that the situation with respect to supply has stabilized, and that's an important thing. I've heard from a lot of MLAs and from other people in the community on the question on both sides of the House on this question. It's something we're looking at. But it's important to recognize that our pharmacare system does provide protection for especially for the 60% of seniors that reach their deductible in the course of the year. In other words, once they reach their deductibles, they're getting either 70% of reimbursement, and then when they get to their family maximums, 100%. With respect to other vulnerable people on income assistance and disability, they're getting a 100% reimbursement from the beginning, as do others in the BC society. So we have a pharmacare system designed to protect people. There are some concerns that have been expressed by a lot of people about having to pay more, and because this pandemic has occurred early in the year, people have not reached their deductibles yet, so it's causing, for some people, some cash flow problems, and we're certainly looking at that. Officials of pharmacare are looking at that with me, and it's certainly an issue that's been raised with me frequently.
Thank you. Next question is from Renee Filippone, CBC.
Hi, Premier. Dr. Henry, let's ask this one to you specifically. We were hearing from the Premier, that's what I was going to say earlier today. He was talking about issues about people going to work sick. Speaking about the poultry facilities, and he said, quote, the majority of cases linked to the poultry facilities were people still working, including the inspectors. And we're trying to get some clarification on whether CFIA inspectors tested positive. Were they at work sick? And if so, were they at work sick symptomatic? If that is the case, how much confidence do you have that the CFIA is doing what they can to keep these plants safe? And also, just a follow-up, would or could BC impose a non-movement order for staff between poultry facilities like they have when it comes to long-term care homes in the province?
Yeah, so when the initial poultry farm was identified, as I mentioned, it was identified because a community case was identified in Vancouver Coastal, and on investigation, the public health investigation identified that many people in the work environment were ill. And, you know, this is the challenge with this virus, is that people may not recognize it or may think they have something else. So that is why we're testing everybody within the facility, and we had a very low threshold. So there were a number of people from all sorts of parts of the facility who tested positive, as you can imagine. So yes, it's been a concern, and the primary concern is people working ill and spreading it to others within the workplace. So that's what we're trying to address. I did have a meeting with the leaders of the poultry industry, including the industry, the owners and operators of these plants, as well as CFIA was on the call, and the Ministry of Agriculture, etc. And we did talk about the importance of maintaining the workforce, putting in place the appropriate provisions, and that the safety of employees it guarantees the safety of the business, and that we need to work together on these, particularly for the coming year. But this is something where I expect and hope that it will change our policies and our thinking around working sick for the foreseeable future, or maybe forever. And they did also assure me that it's quite rare for people to work in more than one facility, so that is not apparently a large problem. And the public health inspectors who are leading the investigations are looking into that as one of the issues, but it's not apparently been a huge issue.
Next, we have a question from Marcella Bernardo, News 1130.
Thank you. I just had to take it off mute. Dr. Henry, and to some degree, Minister Dix, I was hoping to ask you about the situation where we've repeatedly heard people saying that most people in BC are following the rules, but there's a significant increase in traffic numbers, and now we're hearing that boaters are being encouraged to ignore the Coast Guard's request to stay off the water. So how concerned are you that people are starting to get lazy and that we're going to start to see more people assuming that it's okay to do stuff that they're not supposed to be doing yet?
Yeah, this is a challenge for all of us, and I think we have to continue to be positive and to be supportive of people to do the right thing. And we have seen repeatedly that most people do. There are, we're now coming up into the season where people want to go boating, people want to go fishing, hunting, those things. They want to get out more, and we need to be able to show them how to do this in a safe way. What I'm saying and what we've been saying is, we're almost there. We need to give it a bit more time. We still have cases and outbreaks in our community, and these industry outbreaks, the poultry outbreaks, are a warning to us that we don't yet have that way of thinking within our industries, within our businesses, to ensure that people aren't coming in ill. And these are really important things that are going to keep us safe for the coming weeks and months. So now's not the time to what was it that we were saying, to bend the rules. It's the time that we need to continue to bend the curve. It will happen, and we will be able to support people to do it safely, but now is not yet the time to do that, and it can set us back if we're not completely committed to making sure that we continue to support the physical distancing that we need to do, to take the measures that we continue to do here to make sure that we are out of the danger zone. And then we can let things up. And we'll let it up in a measured way, and we'll support people to be doing it safely.
Next question is from Andrew McLeod, the Tyee.
Yeah, hi. Minister Dix gave an update yesterday on purchases of PPE. I have a couple of questions related to that. One is how that's distributed, whether that's mostly for the health authorities and the hospitals, or whether that's more broadly for long-term care and everything. And also, what are you observing now on prices?
Well, I think it's fair to say that the market is very different internationally than it was in December and January on prices. What we're doing and the product that we've purchased, in addition to connecting and continuing to receive supply from our traditional suppliers, is seeking out new supply. So what's different now about the new supply is the need to test, and we've been doing that vigorously in BC. We received supply some weeks ago that we've tested and is potentially ready to be deployed. That work is led in BC by officials, leadership in the Ministry of Health, but principally by the Provincial Health Services Authority, who have been addressing the distribution of that throughout the province and throughout the healthcare system. So that's the process that we go through. I can tell you that it is a very, very challenging international market. It continues to be. But we've had, I think, some success in identifying supply and testing that supply. And the goal now and the challenge now is to work with people who work in healthcare to ensure that the supply works for them, that it fits well, that we can address that part of the process. So I really want to give a lot of credit to all the people who work in healthcare, the people who are represented by all unions in healthcare, the HSA and the HEU and the BC Nurses Union, the BCGU and others who have been done a very good job, I think, conserving existing supplies as well and using it properly. So we've been able to extend with existing supply through this period. But look, it's been a challenge to and a test for us to obtain PPE. I think we've had very significant successes. As of last week, for example, it's slightly above this now, more than 3 million N95 masks. But that said, it's going to continue to be a challenge over the next little while. We continue to need to have protocols for its proper use in all of our workplaces, and to ensure that it gets distributed and it gets out to workers in the appropriate way, and that they're fully consulted on its use. So those are the things we're dealing with now. It's mostly led in BC by the Provincial Health Services Authority.
Next, we have Glenn Korstrom, Glacier Media.
Hi, thanks for taking my question. It could be for you, Dr. Henry, or for Minister Dix on what the roadmap looks like for non-essential or the surgeries that were canceled, the scheduled ones. I'm not looking for a timeline, but rather a sense of which surgeries would come first, and then second or third. Would it be hip replacements or cancer? I've heard has been suspended as well. So what sequence and how are they going to be different once they take place?
Yeah, so there is a very detailed plan that will become apparent very soon, and I'll let Minister Dix speak to it. But it's a combination of things. And so clearly, cancer surgeries, many of them have continued. We've talked about, the 13,000 surgeries that have been done. There are ones that are very time sensitive, where we know there can be a dramatic decrease in either people's well-being or the increased in mortality if they don't get surgeries within a certain period of time. So obviously those ones are prioritized. We also need to prioritize by the use of critical care resources and making sure that we have the surge capacity in critical care should we start to see a surge in cases of COVID-19, because we know that that's really important for saving lives. So there is a balancing act, and there has been a lot of thought going into it. There are many types of conditions that can be optimally managed medically through a period of time before surgery is required. So there's that balancing of ensuring that we're doing optimal medical management for a number of people to be able to postpone that need for surgery for a longer period of time. And then, of course, there are the really important ones that people have been waiting for a long time, that are important for their quality of life, their ability to get around, and hips and knees being an important one of that. So I don't know, Minister Dix can talk a little bit more about it, but there is a plan.
And as I think you said before, Glenn, it's been led by Michael Marchbank, who is a former president of the Fraser Health Authority, a highly respected person in healthcare in BC. And there'll be a comprehensive plan. And of course, we're not going to lay it out in bits and pieces, but we'll be presenting it and in detail to you in the coming days and weeks. And I think it's important that British Columbians who've had their surgery canceled know that we've been thinking of them from the beginning, that this plan will obviously assess both our capacity in hospitals, our capacity in clinics that do surgeries as well, that all of which do day surgeries. In other words, it's all important surgeries, but do some of the less serious surgeries, because people do not stay overnight in private clinics that perform surgeries in the public healthcare system, for example. So it's a full assessment of our capacity, of our ongoing capacity to deal with COVID-19, the need to plan over a period of months, including into the fall, and the inevitable arrival of influenza season at the very least, and what we might plan into the fall. So that's the plan we're going to present, and it's important to note that we've done so many emergent and scheduled surgeries that are urgent. We said that those wouldn't be canceled. Obviously, surgeries that have to take place in 2 or 4 or 6 weeks still needed to take place, and we've done the surgeons and others and all the nurses and everyone in the healthcare system's done 14,597 of those. So you'll be expecting to see a plan soon, and that it will address all those issues, including issues around priority. I just want to say briefly on pharmacy. I want to say a couple of more things just to put it in context. One of the reasons why it was a challenge to go to 30-day refills that people thought about, and why we didn't do it as an absolute rule in BC, was because obviously people struggle going back and forth to the pharmacy more often, and this was a balance. And I want to thank everyone involved in pharmacy in BC for their ongoing work that they've been doing in the province over the last period. Just to put it in context, the number over the last month, the number of refills of over 70 days, so the long-term refills, dropped by about 6.7% in that time. So put it in context, we would do about 700,000 of them, and about 50,000 or so of those, we did about 50,000 less than we usually do. So there was still a lot of refills of 70 days and above. But I do think the ongoing work of pharmacy and the ongoing work of pharmacare is really important. But that gives you a sense of how many people had their prescriptions filled for more than 70 days during the first month of the really intense period of the pandemic.
Next question is from Jeff Andreas, Radio NL.
Thanks for taking my question. I just wanted to follow up in regards to PPE. It's been a while since I've heard anyone here talk about the ability to clean and reuse some of our PPE, and specifically respirators. And I've talked to a few people who have sort of been, re-engineering equipment to be able to disinfect N95 masks and reuse them on, for a large number of times. I was just wondering if there's been any progress in BC on the ability to clean PPE and how much that would really help with the stockpiles that we have.
Yeah, so that is something that we actually took on early in this whole pandemic, and have been connecting with our colleagues across the country to support as well. So yeah, there's a couple of different types of processes that allow for re-sterilizing and reusing of disposable PPE, and particularly we're focusing on respirators, N95 respirators, and there is a process that we're using. We're finding it's more of a challenge than thought. It certainly is easier to, it's much more important in some of the smaller areas where it's more of a challenge to get product back and forth. Having said that, we have not had to use any of the sterilized products yet. They are being kept, they're being monitored, they're being checked for quality assurance. And I think the important thing is that we think about the disposable respirators that we have as single use, but they're not. They can be multiple use, and there's good evidence that they can be used up to 20 times if appropriately reprocessed, is the term that's being used, that we use to talk about this. Having said that, they need to be clean, so they can't be soiled or damaged. So, and that is sometimes a challenge as well. So it is a process that we're continuing to investigate, continuing to use, continuing to stockpile, and to make sure that we have in our back pocket for when and if we need to use it.
We have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question today is from Sean Brady, Kamloops This Week.
Hi, Dr. Henry. With the decision to close provincial parks and lakes and recreation sites, we've heard about bigger crowds at outdoor sites that don't fall into these categories. So by reducing the number of places that we can go outdoors, are we increasing the chance of transmission at the remaining places where people can still go outside?
So a couple of things on that. I will note that it was not me who closed the parks. This was a decision made by government, and for a variety of reasons, as I've mentioned before, primary of those being the increased concerns that we would have about people gathering, certainly, in areas and using the facilities, but also primarily because of our forest fire risk and the challenges that has given us. Particularly, we had a very dry April, as people are aware. So when it comes to transmission outdoors, this is something that I've obviously been following very carefully around the world, and there is clusters and studies of clusters of transmission that help us get a better understanding of, is it more likely or less likely that you're going to that transmission will occur indoors versus outdoors. What I have said many times, and what the data supports, is when we're in close contact with somebody that this can happen. And we spread droplets. The droplets fall away relatively quickly within a short distance from us, and that is more likely for us to transmit when we're having close contact over time with people in an enclosed environment, having dinner, having meetings, living with somebody. And even in those situations, we don't see 100% of people getting infected, but we do see transmission much more commonly when we have people congregating together in close proximity, usually indoors. There was one study that we've been looking at that looks at 138 different clusters, and there was a single one that was associated perhaps with people in close contact outdoors. So the transmission risk is much less outside, as far as we can tell, in that as long as we keep our physical distances from people. So being outside, as long as you're with your group, your home, your bubble, that is fine. And maintaining your distance from others. The risk that somebody who is sick is spreading this virus from coughing or sneezing outside, and you walk by them very quickly, even if it is within 6 feet, that risk is negligible. That's not the way this virus is mostly transmitted. I mean, we always say never in medicine, but the risk would be infinitesimally small. If somebody runs by you, somebody walks by you, even if they were within 6 feet, which is not to say that it's okay. We all want to keep our safe distances, mostly for people's comfort, so that we're not, we're not giving people anxiety. Right now, we need to be very cautious. We need to be kind with each other. We need to recognize that we still have a lot of anxiety, and people are very concerned about this. So please go outside with your family, but stay away, keep your distance, smile, talk to your neighbor, wave to them, be supportive of each other, but do it in a way that maintains that distance right now, and make sure that you continue the important things that we know work to prevent this transmission of this disease, which are cleaning your hands regularly, covering your mouth when you cough, keeping that safe distance, and staying home, and don't go out if you're feeling sick yourself.
That's all the time we have today. Thank you.